Good evening, everyone. Welcome to the last Lung Cancer Living Room of 2024. It has been quite a year. I'm so happy to have all of you in the room with us and all of you joining us online tonight, and those of you who may come back and watch us post-live. I'm Danielle Hicks, for anybody who might be new to this programming. I am Chief Patient Officer here at GO2 for lung cancer, which really just means that anything and everything that has a patient touch, I oversee. So all of our support services and programs, such as the Lung Cancer Living Room. Normally, this meeting is a time where we bring in expert speakers from varying aspects of the lung cancer community to come in and talk about those varying aspects of being at risk and diagnosed with lung cancer. But tonight, as has been tradition for the last 4 or 5 years, what we're doing is I'm going to be the expert tonight, and I am going to give everybody some updates on what GO2 has been up to and accomplished this year. And then we're going to take it back old school a little bit, and for those who feel comfortable, we're going to do it around the room. I think a lot of you who know and have been attending this meeting for several years now know that we used to start this meeting with an around the room, and it was about a 2.5 hour meeting when we used to do it that way. And COVID kind of, forced us to pivot into something different. So now we've split up the around the room conversations from the living room, and Michelle hosts the Tuesday before this meeting what we call Gathering Hope, and that's really an opportunity for people diagnosed and their loved ones to come in and have those sort of roundtable conversations about whatever it is you want to talk about. So tonight, in celebration of the entire year, we thought we would bring it back again, time permitting. As you can see, my co-host extraordinaire is sitting with me tonight, Bonnie Adario. Sometimes she's here, sometimes she's not, but we love it when she is, particularly at the end of the year. So a big welcome also to her for being here. As I think a lot of you know, she retired about 2 years ago now, so some of this might even be a surprise to you.
It's kind of like some of my friends, how they retired.
Yeah.
A little in, a little out,
Yeah.
out, income. Maybe no, maybe yes.
Yeah, it works. We do have a lot of stuff to cover tonight. I'm going to do a lot of reading from this document in front of me, so please don't judge, but my colleagues and friends at GO2 have shared some of their high-level accomplishments this year. As I've said in the past, this is not meant to be an exhaustive list of all of the work that has been done by the folks at GO2, but really just more of that sort of high-level overview. And I know a lot of you in the room support us not just by coming to meetings like this, but in various other ways that I think we'll be talking about as we kind of walk through what some of these accomplishments are. I, for one, am incredibly proud of this organization. I will start by saying that I have always and still do believe wholeheartedly in the work that we are doing and the impact that we have on this community. I will throw out an ask right now, and I wasn't planning to do that, but for those of you watching who might know other people who have been diagnosed or at risk, tell them about us, because I think the support services and programs that we provide and some of the other work that we do are second to none, really. Everything that we provide happens with people that actually work at our organization, people who are committed to affecting change in this disease. So do you want to say anything before I start?
Yeah, the only thing I would say is, well, first of all, Merry Christmas. That's
Happy holidays.
And happy holidays.
Happy Hanukkah, yeah.
But aside from that, I'd love to see more people access what we have to offer, because they're not all, involving themselves in what we do, and it's such a great thing. So I would love when you guys are all kind of going around the circle tonight, maybe you can talk about how important it is to have people to rely on and, just
I agree,
do those
and I
things
think
for
it's
you.
not just GO2 as an organization, but
Right.
the community, such as the people in this room and the people online and the people we meet on the road and, in various places around the country and really around the world. It's a community that's been generated and the coming together
Right.
of everyone that is so important. So, as I said, there's a lot to talk about, and I'm going to start with advocacy, which is
Sorry.
something that, particularly in the last 6 years, I've embedded more into the work that I do here at GO2. It was an unfamiliar territory to me. I think you guys have heard me in the past, refer to like my basic knowledge of what policy and advocacy work looked like was a little cartoon I used to watch as a kid with a bill hopping up and down, talking about I'm only a bill sitting here on Capitol Hill. That was really the extent of how the intricacies and how all of this stuff worked prior to all of this. And Elridge Proctor, who is a dear colleague of mine who spearheads our policy work, does an absolutely amazing job advocating from a federal standpoint for this community. So our policy work really advocates across the entire continuum of care. Key areas of focus include not only increasing federal research funding, but ensuring access and affordability to quality care and screening, and addressing the needs of those vulnerable, it's always a hard word for me to say, and underserved in our community. And that we do have, as I think most of you know who are no strangers to this organization, a real emphasis on women and veterans. And you'll see on the tables in front of you, and I think you probably have all seen it before, but the incidence of lung cancer in women, particularly never smoking women, is on the rise, and we don't know why. So we really need people to stand up and address it as a public health issue as a whole. So I'm going to start some of our highlights with talking about the Voices Summit, and I know a couple of you people in the room, and hopefully some of you online have attended. This year, we gathered the largest number of, air quote, voices to advocate in Washington, D.C., and to really educate our lawmakers on the needs of our community. We had 38 states represented. Next year, we hope to have all 50, so pay attention. We're coming for you. And we participated in 150 meetings in one day with members and staffers on Capitol Hill in support of all of our issues. We sent out collectively, not we GO2, but we collectively as a community, sent out over 1,000 messages to Congress, and 23 copies of our Hill ad were distributed to members. And for those of you who were there, you might remember these little newspapers that are in every congressperson's office, and we had a big ad in there kind of continuing to sort of shout from the rooftops who we are and what we're doing. We secured another $25 million in federal lung cancer research funding, bringing the total to over $245 million, or almost $250 million for our research community since the lung cancer research pipeline was started by GO2 for Lung Cancer, formerly Lung Cancer Alliance's piece of this, in 2008. So that's nothing to shake a stick at. Advocates who attended the 2024 summit were polled afterwards, and the general sort of feeling from everybody was that the amount of information, hope, and inspiration that they received was a life-changing experience. So in spite of whether or not you love Hill Day and actually walking all over Capitol Hill, talking and being in all 150 of these meetings, it really is quite an experience. We also continued our advocacy work to expand screening eligibility. That would allow another 5 million people to have access to screening. Some of you may remember, and I've said in this meeting before, the American Cancer Society came out saying, hey, we need to get rid of this 15-year, some of the criteria for screening is you have to have quit within less than 15 years. And the ACS said, no. We need to take that out of the criteria. And so we are powering and moving forward, talking to other organizations and trying to work with USPSTF to get that actually into the guidelines, which would open up screening to another 5 million people. So just under 16 million people, as opposed to the 10 right now, that currently qualify would be eligible for screening. And that 16 million people a year is a pretty big number. At the state level, we now have 20 states that will cover, and they've made part of their cancer plan, their state cancer plans, to cover and reimburse for biomarker testing. Obviously, we want all 50 states involved in that, and I can assure you that our coverage reimbursement and policy, our government affairs team in general, is working hard state by state to ensure that that happens. And one last important milestone that is literally hot off the presses from yesterday. Some of you may have already received communications from us about this, the call to action on what has happened right now. But our Women in Lung Cancer Research and Preventative Services Act, that really is intended to bring needed national attention and research to lung cancer's unique and devastating impact on women and our underserved population. I touched on that a little bit ago. The bill passed through the House of Representatives, which is a huge, huge, huge win. And we're now trying to get the bill to the president's desk to get this law enacted. So this is going to take some work. We're specifically looking to enlist constituents from Kentucky, New York, Louisiana, and Vermont. So we're asking everyone in those states to consider writing a letter to their senator. And by writing, I mean utilizing our template. We're trying to make it really easy for everyone. There should be a little URL coming up on the bottom third if you're watching from home right now, and something I can share with folks in the room afterwards, because California is important. I'm going to tell you why in a second. We make it really easy for you. So you click on that URL, you find this Women in Lung Cancer Preventative Services Act bill, you click on it, there's a letter, we help you get it right where it needs to be. The reason California is an important state to consider when trying to advocate for this bill to officially be passed is Senator Dianne Feinstein, the late Senator Dianne Feinstein, who actually attended one of our galas many, many years ago, was a huge advocate for this bill. So it's incredibly appropriate at this time on her behalf and to also submit a letter to the senators that are listed. So I can't say enough about this. I think Elridge is online right now asking and available to answer any questions to folks who might be tuning in from one of those states. And of course, any questions that come up after you think about it a little bit, I am happy to shepherd over to Elridge. But there is a tight sort of timeline on this. I mean, we need this help now, and by now I mean in the next 3 days. So that's why I'm making such a big deal about it. Last but not least, from a high level, standpoint, this isn't an exhaustive list. Registration for next year's Voices Summit is open. It closes January 31st. I think we said we had 38 states last year. We would love representation from all 50. I can give a big shout out to my home state of California by saying we always have the largest crew of advocates that are maybe not the largest, but one of the largest states represented on Hill Day. And there are full scholarships available for people diagnosed with lung cancer. So your travel, your airfare, your hotel will be covered if this is something that you are interested in doing. And I highly recommend it, even if you only do it one time. It's quite an experience in DC, again, with fellow advocates storming the Hill, as our CEO likes to say. Next, I'm going to jump into events. So my dear friend and colleague, Jennifer Hughes, who's typically in the room on living room nights, but was unfortunately unable to be here tonight, leads a team of really extraordinary people who run all over this country, hosting things such as our 5K event series, our endurance events, our do-it-yourself sort of events that people, sort of pop-up events that happen around the country, and then our signature events such as the gala. And the overall revenue for the entire GO2 event program is up 20% from last year. And I think that that's a testament to the hard work that Jennifer and her entire team do to help. We really consider Jennifer's work not just fundraising, obviously that's a piece of it, but this in community engagement, embedding ourselves in these communities, letting people know we are there for them, giving everyone a day to come together. So I'm really, really incredibly proud of that team. Our 5K event participation was up 3% versus 2023. So that 20% up was only with 3% of people. So it goes to show you what even a small percentage of people, the impact that they can have. And this was one of the really exciting sort of bullets that she sent. We have an endurance program where, for those of you who might have been runners or know people that are, I certainly am not. This is a marathon program. The New York City Marathon is one of the events where people can get bids from us and then they fundraise. And the New York City Marathon set a new record, independent, so just that marathon, in raising over $72,000. And it's the most raised by a GO2 endurance team since the whole program started. This year's GO2 Shine a Light on Lung Cancer program, again, those of you in the room know Katie Morello, who runs this program. And it's really part of our Lung Cancer Awareness Month. Throughout November, there were 255 Shine a Light events that took place, helping to raise awareness, honoring those affected by lung cancer, and bring the communities together, really in support of our cause and support of one another. We're proud to say there was at least one event in every state, including DC, and one in Ireland this year. So we had global Shine a Light events, which is really exciting. Healthcare delivery. So you guys may have heard me in the past talk about this and really referring to it as our Center of Excellence program. So we have been doing, not we, well, yes, we as GO2, but our healthcare delivery team, spearheaded by my colleague Joelle Fati, have also been doing yeoman's work this year. And over the last couple of years, sort of shaping what this program looks like. It used to really be, you were a center of excellence in screening and or in cancer care delivery. And she and her team, with the help of others, have really come together and created what is a designation-based center of excellence. So you have to either be excellent in screening or comprehensive cancer care. But you can also apply for all of these other designations. And I wish Joelle was in the room because, don't quote me on this, I think there's maybe 9 other designations, but they are excellent in biomarker testing, excellent in community-based research, excellence in IPNs or incidental pulmonary nodules, which we know too often go unnoticed, excellence in health equity, and it kind of goes on down the line. That is not all her team does, but it is a bulk of what her team does. And this year, we had 23% of the COE Center of Excellence growth, including expansion with another Veterans Affairs facility. And we have over 900 facilities across the country. We launched our healthcare provider website and COE portal, both focused on our programs and services that support frontline community public health and lung cancer providers and partners to help them deliver high quality lung cancer care where people are in their own communities. We held our 10th annual COE Summit in Chicago, which I attended, and it was absolutely fabulous. It was the largest summit to date, with nearly 300 healthcare providers, nurses, and navigator attendees, covering topics by national experts across the entire care continuum. And this is our second year of our lung cancer navigator program. I think historically when we've talked about it, we talk about nurse navigators, but you don't have to be a healthcare provider to be a navigator, right? Like, I'm not certified, I'm not a nurse, I'm not a social worker, but I have been trained mostly in real time on how to help people navigate through the process. So what Joelle and her team have done is really come together to create this lung cancer navigator workshop, which really helps to prepare these folks who are working in their local communities to deliver this high quality care to people both at risk and diagnosed with lung cancer. I am going to move to science and research. And there's a lot going on. For those of you who, again, are regulars to this meeting, it's not often that we're not talking about what's going on in the science or research community in all of our living rooms. And this is just a really quick snapshot. So outside of GO2, there have been 14 FDA approvals in different subtypes, stages, and lines of therapy for lung cancer just this year. Again, you guys have all heard me toot my horn about how 15 years ago, 18 years ago, nobody was working in lung cancer. It was the same old, same old. And now we are really at this time and at this pivotal time, I think, where everybody's working in lung cancer. So 14 new approvals this year. GO2 and Alchemy. Again, for those of you who are new, Alchemy is our sister organization. It's the Dario Lung Cancer Medical Institute, which is a collaborative consortium of both academic and community centers, really agreeing to come together and play nice in the sandbox, to put it really simply. But rather than working, in their own labs, sort of in their own siloed way, they're saying, okay, where are gaps where we, what gaps can we identify where we can all agree to come together and work on certain projects. So over 250 people were enrolled in GO2 Alchemy research studies this year. Together we launched SPARK and Inherit studies, both set up to help identify genetic risk factors or early markers and resistance. You can interrupt me anytime you want, I see you. Okay. Additionally, there were 5 community cancer centers that were identified to test the implementation of in-house next-generation sequencing. So in academic centers, quite often they have the capabilities in-house to run this biomarker testing that you guys hear us talk about all the time. But in community centers, they do not. So they are dependent on outside diagnostic companies. So you have to collect the tissue or the blood, send it off to these outside companies. They run all the tests, send the information back. So we're running a study to see what the turnaround time looks like in the community centers when they actually are able to provide this diagnostic service in-house. Foundational work for Succeed, and please don't ask me what the acronyms are for all of these. I should know them, but I don't. But I do know what they all do. So Succeed is really working in small cell lung cancer, which I think you guys know for the past couple of years has been a large area of focus for us, not only in investing in research to try to provide more options for this subset of lung cancer, but in trying to generate community that everyone has in non-small cell lung cancer. Quite often, the small cell lung cancer patient continues to feel more isolated and alone. They're not part of a community such as the GO2 community, and they're still living in the shadows. So this is a really a feasibility study and a sample collection of newly diagnosed small cell lung cancer patients. It was late in 2024, and we're going to begin enrolling in 2025. Health equity, we made a commitment a couple of years ago. There are a ton of gaps when looking at what healthcare looks like across diverse populations. So we began partnering with our COE network in 2025 to enroll patients in the Justice study, which, Mom, I know you're familiar with because I took over your spot with the folks down at Moffitt in Florida. And it's really a study focused on understanding responses to immunotherapy in the African American or Black population. And this will fill a large gap in understanding the knowledge around the biology of response of immunotherapy in this subset of the population. We educated over 300 individuals from Black communities on lung cancer screening with a pre and post assessment to really measure impact. Like when we get in there and we start talking to people, what do they know about screening at the beginning and what do they know at the end? We trained over 100 HBCU students in lung cancer navigation with evaluative measures and fostered 4 new community partnerships to help expand screening and navigation in these communities. In 2025, we plan to engage 300 additional individuals in Black communities to explore treatment gaps and challenges in biomarker testing. So similar to the work that we did in screening, we're bringing up to biomarker testing through education and support initiatives. And simultaneously, we'll be developing a geospatial tool. And this is all where I also kind of feel like it's up in the clouds above me, and I understand all this geospatial stuff, sort of. But really to identify areas within the where there's the greatest treatment disparities between the Black and white communities. And we know that there are disparities across the board. But we're really hoping that this will help to provide a future roadmap so that we can pilot programs and with targeted interventions. The lung cancer registry is continuing to grow. I know a lot of folks in here have participated in one or more of the surveys within the registry. We have users representing over 66 countries. The registry is available in, Heather, if you're watching, 6 languages, I think, maybe 9. And we released a new registry survey in 2024 for lung cancer risk, really helping to sort of tie in some of the work we're doing, from a research standpoint. GO2 and Alchemy, what's the patient perspective? Tell us what's going on in your life and how might we be able to pull that together. We launched a new registry platform with an improved user experience, and we are set to launch this new platform, fingers crossed, by the end of this week. And it's really set up so, again, that user experience is better for the person taking the studies, but it's also going to allow you to look at the information you have put in and sort of benchmark it or look at it against aggregated data, de-identified aggregated data from other folks. So you can see kind of how you might be matching up with other people in the registry. Our Lung Match program, if you are not familiar with our Lung Match program, it is one-on-one navigation that runs through our science and research team, but is a sort of dotted line to our patient support services, where our Lung Match navigators will help navigate and walk you through biomarker testing at diagnosis, at progression, some of the biomarker testing reports that come out that are incredibly confusing, not only to the person diagnosed and their loved ones, but quite honestly to the healthcare providers that are reading them. So they'll help navigate through that. And if you're curious about clinical trials, and in my opinion, you should at minimum be curious about them, they can help talk you through not only what a clinical trial is, but what clinical trial might be right for you and where they are in this country.
Did you mention Inherit? Okay.
Yeah. Jumping into patient support programs, which is my sweet spot, we increased our reach into our people at risk and diagnosed populations across all of our programmatic areas. And just to kind of highlight what those are, there are our helpline, our phone buddy program, our Health Unlocked online community, both non-small cell and small cell, our publication series, which I'm going to jump into in a little bit, our Gathering Hope, which I touched on at the front, Living Room. And then we added this year, which you've also heard me talk about, Mind Over Matter, which is a 5-week coping series. We know that outside of all the clinical stuff that people are trying to understand and deal with, there are some coping strategies that we can help with the fear and the anxiety that come along with a lung cancer diagnosis. And Sarah McHale on our team, who joined our team earlier this year, successfully completed 2 of those sessions this year, and we plan on continuing it next year, as well as hopefully, fingers crossed, being able to open it up to caregivers as well, because our caregivers have their own sets of fears and anxieties when helping a loved one through a diagnosis. We added 7 new pieces of education materials, so we're now at 40-ish different publication pieces covering all aspects of the disease, from being at risk and screening and lung nodules and what all of that means, all the way through the care continuum. The 7 that, and they're offered in, you've also heard me say this, I've said this like a million times, it's like I feel like I'm on repeat, right? But they're offered in the bite snack meal options. We know everybody likes to learn things differently. Some people want a 1-pager on something very specific, and then the very end of that spectrum is some people want, no, we want the whole comprehensive handbook, which I think we moved it for the tree, but which is really your A to Z, everything you need to know about your lung cancer diagnosis. We did successfully break those out this year into non-small cell and small cell. They all used to be in one book, and they were both translated as well into Spanish. We created our prophylactic cranial irradiation booklet. I don't know why I'm so tongue-tied tonight. It's probably my cold, my snarky medicine. Really looking at PCI and cognition and brain metastases, particularly in small cell lung cancer. Our side effects booklet. You're attached. Where are you going? Oh, Lordy. Bonnie, look at me. There's a thing right here. Oh, she taped it to your back. Somebody help her. There we go. You are in jail. Don't worry, James will edit all that out. Our side effect booklet. Side effects are very different for small cell lung cancer patients than they are for non-small cell lung cancer patients. So we were able to break those out. And I'm very proud of our comprehensive patient support services booklet, which takes a little deeper dive into each of our programmatic services and how they can help people. We also launched our new e-commerce store. She wanted to bring Larry a pillow. That's why she got up. Our new e-commerce store where you can order hard copies and downloads all from one place. All of these materials are free. And I promise that the user experience and the checkout experience is way easier if you've ever been on our previous store. We had our first ever in-person Gathering Hope. So again, Gathering Hope is around the room. We did that at the Voices Summit in Washington, D.C. this year. And when I say it was a packed house, I mean it was a packed house. We need a bigger room if we're going to do it again this year, and I do believe that we are. We had living rooms in Hollywood, Florida with Dr. Reyes down in South Florida there. We had living rooms at both the Medscape Conference, our COE Summit, and internationally at the Latin America Lung Cancer Conference meeting in Bogota, Colombia. So those were outside of our regularly programmed meetings. We exhibited at 8 different conferences, at all of our 5K events across the country, at our Voices Summit, our COE Summit, and and I already said our 5K events. We partnered with many different hospitals, corporations, and organizations to really try to blanket the community with information on how we can help support people through a lung cancer diagnosis. And this is another thing I'm really incredibly proud of, is that the patient support services team had 7 abstracts accepted this year. So the work we've done, we submitted abstracts to conferences. We had 6 at the World Conference on Lung Cancer and at the 1 at the World Cancer Congress. So that's sort of in a nutshell, and I know I sped through a lot of that, but I really want to get to the meat of what this meeting's about, and that is all of you. I also want to invite people who might be watching online to share their stories, type away, and Michelle can share them back out for you. But really on behalf of GO2, I just want to give a big shout out to all of you who I know have embedded yourselves in some form or fashion into the work that we are doing because you believe in the work that we are doing. And I believe you believe in it because it has somehow positively impacted your experience. So just, sorry, Bridget, just from the bottom of my heart, I mean, I cannot thank you enough personally, and I know GO2 thanks you as well. So now this is the part where I want to move into the conversation, and then we can do our holiday celebration once we're done with that. But I really want to hear from you all, and there's absolutely zero pressure. And I'm not asking you to think back on, your entire lives, but, at minimum, this last year. And it doesn't even have to be about GO2, but where have you found hope and inspiration? First, introduce yourselves, tell us a little bit about who you are and how you got here, but then tell us a little bit about where you found hope and inspiration, because you might say something that people either watching online, people in the room, or people that will come back and watch post-live hadn't thought about. And I don't know who wants to start. My favorite part. It's my favorite part. Do I have any volunteers? You can make me call on somebody. Thank you, Larry. I knew you'd be the guy.
I didn't want to leave you stranded, Danielle.
Thank you. I appreciate you so much.
My name's Larry. I was diagnosed in January of 2013 with stage 4 non-small cell adenocarcinoma with an EGFR mutation. 2 weeks ago, I started my 5th different protocol. I've been very, very fortunate. And I think where I find hope is in this room, for number one. I've been very, very fortunate over almost now 12 years, And I think a lot of that is due to what I've learned, what I've been guided through by GO2. Coming to the living room, watching the living room. I've been educated by some of the greatest lung cancer leaders in the world, actually, not just the United States. That education has empowered me to be actively involved in decisions when I need to change treatment. One-on-one sessions with the patient services team to talk through those decisions. And just understanding things like why you want to have a multidisciplinary team. And all of those things provide exactly what it says up there on that wall, hope. And that's what we all need to get through every day. So those of you who are watching live or in this room, the services that GO2 provide for all of us are very, very important. And I have no doubt that my life over nearly 12 years living with lung cancer is very different because those services have provided me with amazing support. So I encourage everyone out there, including everyone in this room, to take advantage of those services because they can do for you what they've done for me.
Thanks, Larry. Larry's being a little bashful, but Larry gives back just as much as he says that he's gotten. Not only does he show up monthly to this meeting, but he's a phone buddy. So he's a mentor to people who are newly diagnosed, who match most closely with him and his diagnosis, and has been an amazing ear for many, many, many people in helping them through some of those tough days. And we can't thank you enough for your volunteer efforts and being a mentor for what I know are so many. And you also came to the Voices Summit last year, which, it was a whirlwind. We did have a little stomach flu or some kind of virus running through that conference, and it was a little sketchy on Hill Day, but he came to experience that as well as many other things that he does to help support us. So thank you, Larry. There, you don't have to be a patient to talk if you want to say anything.
Okay. I'm Larry's caregiver. Got it. Wife, caregiver, yes. And I think the thing that has given me hope is that I knew, especially in the last couple of weeks, which have been very rough when Larry started his new treatment, that I had a place to turn to get answers and to have people listen. And I just needed somebody to listen because I was totally out of my league. I mean, it's been obviously 12 years, but this last go around with the chemo completely knocked us off our feet. And I was scared. And besides turning to good friends, you guys were all here for us. So I appreciate that. And as a caregiver, I think we need that.
Thanks, there.
Well, and it's not just the patient that we work with, it's the patient's families that we work with as well. And we can't forget that. They're equally as important as all the rest of us in this room.
Yeah, agreed. Jane, you're going to talk. You don't have to. I mean, nobody has to talk, but I'm going to ask that the mic go all the way around. You can pass.
Yeah, no, let's do it.
Well, sitting in this room, no one, having been diagnosed 12 years ago, the same week as Larry, with the same care, support that we've had, with having called Karen, not knowing who she was, but heard that she might help me handle some of my chemo side effects. And I look around this room, and you are all the silver linings of a diagnosis that no one would ever want. But you, we have each other, and we have so much information. And GO2, 12 years ago, had a goal of, by 2023, making lung cancer a chronically managed disease. And actually, you kind of got that goal, which sounded amazing, but it's happened. And I thank you, Bonnie, you're a leader for all of us always, your daughters, your family, and everyone in this room who feels like family. Thank you for helping me get through this diagnosis and treatment.
Thanks, Jane. You're absolutely right, and I think that was a pretty lofty goal when we made it. And I think we were there for some, but not for all, right? We don't know exactly why some people can chronically manage their lung cancer for decades and beyond, and why others can't yet, which is why I will continue to pound clinical trials and research, into the ears of everybody who listen, because we've done a lot, but it's not enough.
No, it's not enough. However, what we have done is something we never thought we could do. And I'm just absolutely amazed at what we all in this room have done, all the people that are online now watching.
I think one of the things that makes you such a poster child, too, is your diagnosis was so, it was 2003, and biomarker testing, schmiomarker testing, there was not happening, right?
Right.
And you were diagnosed with stage 3B,
Yeah,
adenocarcinoma, and basically told to go home.
yeah,
And were it not for her will and determination, and the will and determination of your family to kind of pull together, like, hey, we don't like that answer, 21 years now, almost be 22,
Right.
pretty
Right.
soon here. You wouldn't be here if
Right.
we'd listened, to the first person. So, anyway.
that was not okay, right?
Yeah.
Not an option.
Yeah.
It's not going to
That's
be an
fair.
option for anybody in this room either, because we are here for all of you.
Yeah.
We are. You are. You're so amazing. I have a little different story because I'm almost next January a 17-year survivor, but I was an accidental finding, and so fortunate because I was only staged a 1B, and back then there wasn't really genetic testing. I learned several years later that I had the EGFR marker, but and then I did just shortly after Jane and I talked, and that was just purely coincidental. I learned about GO2, and I think Jane learned before I did, but from the first time I ever came to a living room, the hope and inspiration, and Danielle, you said this year, I feel like just this year we have so much more inspiration. I just want to learn more to be able to help others. I haven't been a phone buddy, except that I was unofficially with Jane, and I'd like to learn more. But when we get into conversations, I feel like, oh my goodness, I don't know anything. But anyway, I've been blessed to have had the early finding, going through chemo, because Bonnie and I both had Fred Marcus, who was just amazing. And there's so many words for him. And he gave me the choice of having treatment or not having treatment. He talked to me for 2.5 hours. And at the end, it was my decision. And I thought, he's incredibly encouraging, and I need this insurance policy. That's how I looked at it. So I'm here now because he was incredible, and I may still have been here if I hadn't had treatment, but I just feel like I needed to. And I had hope because of Fred Marcus back then, but the whole world has hope because of GO2 now.
Thanks, Karen.
Well, I'm a caregiver.
It's working.
That's a
I'm
good.
okay?
Yeah, okay.
Yeah.
Are you okay, Bonnie? Are you all attached?
Here, we get you back together. Yeah, your microphone. You're all
well,
back together.
sort of, kind of.
Yeah.
We'll worry about that
I'm
later.
worried about that. Anyway, I'm a caregiver, Joanne, my wife, for what, 62 years or whatever it is.
Yeah.
And I second what Larry said, and particularly the idea of hope. And I always got hope listening to Joanne talk to her buddies, and she had, what, 4 or 5 of them over the years. And she'd be in the kitchen talking to somebody, and suddenly I said, oh, that's what it is. And I would learn really more from Joanne as we were driving home from a GO2 and listening to one of the great oncologists
Yeah.
than I would right here. But and that's what's kept me going as a caregiver, knowing that she knows so much about what is her problem and relating it to me, and that gives me a sense of confidence, mainly, and a sense of hope. So what you guys have been doing for what, how many years have we been here for? 8? 8 years. She's a survivor for 8 years, and I'm a survivor for many, many more years than that, knowing what she knows.
Yeah. Yeah. Yeah.
Thanks, guys.
Can you hear me?
Louder, louder,
Oh, great.
louder.
Excuse me. I'm a newbie here, actually, and I can thank my good friend, Sally, because I never knew that she ever had cancer, and I was diagnosed, this is the first year of my diagnosis of cancer, and it's just been, I can't tell you the experience that I've had coming here and the warmth and learning. It's really been a blessing, I have to say. And thanks to Sally, she was my staff during it. That's it. But everything's going fine now, so I'm happy about that. And I think I know you.
Yeah.
Al wants to.
Jackie and I were at a jazz show in Monterey, and you never know how God is going to look over you. We got in a real bad accident. She had to go to the hospital. She got in the hospital, and the doctor told her she had some spots. They took x-rays, and what was it? Cancer. When we got back, she didn't know what to do. We talked and talked. Should she get an operation? Should she go chemotherapy or something else? She started coming, she talked to her doctor and talked to her doctor, and she started coming here. And she finally decided to have, radiation. She had the radiation. It didn't work out the first time. 3 months later, she went through radiation, and thank God, she's wonderful. She owes it to this group.
Well, I'm like Karen. I'm at the opposite end of most of the people here. But my main thing is early detection. I was at high risk, and I volunteered to be in a study that was an international early lung cancer assessment. And it was the rules of you had to have quit within 15 years. I was a smoker, but I also had a mother who passed away from lung cancer, her brother who passed away from lung cancer, and my paternal grandfather. So I felt it was important to enter this study, and nodules were found, but it took 5 years before anything grew. And knock on wood, I had surgery, had a lower right lobectomy, and I'm checked every year, and I'm 15 and a half years out without a reoccurrence. And my main thing is to try and give back and to try and encourage people, if you're at risk at all, go get tested, get the low-dose CAT scan, let your doctor know you're at risk, whether you smoked or you didn't smoke. If it's in your family, you have even more of a risk of it. But anyway, then I accidentally found the foundation, and actually Danielle and her sister had a store on Laurel Street, and I had just heard of the GO2. This was back in 2009. And I saw a sign on the window saying they were closing their store. They were going to go work for the Lung Cancer Foundation. Well, it was the Bonnie J then. And I got so excited, I went right in the store. But anyway, so I've been connected with them ever since. And again, don't put off getting checked if you think you're at all in risk.
Thanks, Sally.
I'm Tina, and I've been here quite a while, so happily. 14 years since my diagnosis, and I've been so fortunate to not have had any recurrence. And I think I'm one of those chronically managed people, actually, because I am still on Tarceva, daily medication, but it has kept my cancer at bay. So it's all good. It's all good. And from the get-go, coming here, I just felt the hope right off the bat when I didn't have very much. I was diagnosed at stage 3B, and that's kind of grim. And I got the hope and the support and the camaraderie. It's pretty great. I'm happy to be here, and I'm grateful for all of you.
And you know, that's actually what newly diagnosed patients want to hear. They want to hear your stories because it gives them hope.
Yes.
So it's huge. It's absolutely huge to all pull together and listen to each other's programs.
Well, I'm Rick. I'm excuse me. Hello. I'm Tina's husband and supposedly her caregiver, which hadn't been a very hard job for me because there wasn't much care to give. This woman is unbelievable. We had no idea that anything was wrong with her. She went into at Kaiser at the time to see her primary physician. I didn't even know she went to this appointment. And anyway, she had something wrong with her neck, and she wanted to have it checked out. And her primary physician said, we ought to do an x-ray. And so they did an x-ray, and guess what? There was a tumor in her lung, one of her lungs. And we didn't know what the hell we were doing. When she came home, she's crying. I said, what's going on here, And she said, I have lung cancer. Well, we didn't really know she had lung cancer, but we went and found out actually very quickly by going to Kaiser again. And I'll never forget this Dr. Who was his name. And he said, oh, you need to get tested for EGFR. What the heck is EGFR? But we did that, and she did that. and she tested positive, and he said, well, you know what? We got this fantastic drug called Tarceva that's just the best thing that ever could happen to anybody that's got lung cancer, and she started taking that. And anyway, through a lot of treatment and through a lot of radiation and chemo, she came out of this thing totally clean, and it's been 14 years. And you talk about somebody that has hope. She's the one. So I really think that the whole idea of hope is real. It works. It worked for her.
Well, it's what you need to hear when you're diagnosed with, when you're diagnosed with anything that's, difficult to deal with, whatever kind of program it is. And this is it. It's right here.
And we've talked about it. I mean, hope is, particularly when you're newly diagnosed, not an easy thing to find. And if programs like this and communities like this and friendships that have built because of programs like this can help drive that hope. And you just said it, you all sharing your stories so publicly like this, the next person that sees this who's maybe more newly diagnosed, whether they're stage 1, 2, 3, or 4 for that matter, hearing you have lung cancer is a devastating sentence to hear. And there are studies that actually show by what I affectionately call keeping your head in the game, which includes finding hope wherever you can find it, is half the battle. People who can ultimately find the support that they need, not just educational support, but emotional support, the coping skills that are needed on the bad days, they do better statistically.
Yeah.
So anyway.
And the sign here, Hope, we created that and brought it to the gala, put it up there on the stage. We didn't think we were ever going to get it down,
We got it up on the wall.
There it all is. And at that point in time, we put everything that we had done thus far.
Or aspired to do.
And it's all there.
I'm going to change it up. Some new aspirations up there. Right?
Yeah.
So my name is Rick Meyer, and I just passed 10 years. So I'm one of the newbies in the room because, everybody's got me beat except for one. So it's rare I can say that. I try to mentor new people coming in because the story when you first hear of lung cancer is like being hit by a truck. You have no idea what's going on. You're scared, and you think your life's coming to an end. And if you can get past that and be in positions like this with GO2 Foundation, the hope and everything, it makes you feel better about being in the right mindset to keep on going. I mean, when I first got diagnosed, you Google lung cancer.
Bad idea.
Like you're going to be dead in 9 months. Really, 9 months. Those numbers have changed since then, but it's because you have to live longer to make those averages longer because more people have to do it. And the technology is so much better today than it was even when I got diagnosed. There was only one med for what I have. I'm ALK positive. The only med for ALK positive when I got diagnosed was crizotinib. Now there are like 8 approved drugs, and I'm on a trial drug, which would be probably a 9th approved drug. And that's how far this industry has come with the help of all the people that are involved in it. So to new people, it's really nice to get involved, find a mentor, get a bunch of studying, and learn because the environment has changed so much, even in my journey, which has only been 10 years now, going for another decade. But it's like you just have to have a right positive mindset and look forward to a nice life.
Thanks, Rick. Go ahead, Ron.
One more time. two things to say about Tarceva, but also about primary care physicians. Joanne and I, obviously Joanne, went through quite a number of months with her on cough drops. We must have gone through, I don't know how many, a year, going through, I don't know how many bags of cough drops. Now, this was my fault, and Joanne's as well. We share this. We didn't think that much about it. And then she went to, you know, she was going to seeing her doctor, our primary care person, all during this year, correct?
Yep.
Never got a word about this except from my nurse, Marion, her sister. And she said, well, Ron, why don't you have a chest x-ray? Which I should have thought about earlier. Joanne, I think, tried to keep putting this thing off. And of course, when the chest x-ray came up, there it was. And we went through the whole process of biopsy down at El Camino Hospital. It was from a wonderful oncologist down there who put us on to GO2 and therefore hope. And her first medication was Tarceva. And she was, and which I, well, this is great. And I don't know, how long were you on it?
2 years.
2 years on Tarceva. But I still had hope, and then this drug came along called Tagrisso, all right? And that brings into my good friend over here, Larry Gershon, who I knew, who the hell is Larry Gershon? Well, Joanne ran out of her Tagrisso. Something was going on with the pharmacy wherever she got it. It was changing hands, or something was bad. And I said, well, where are you going to get the Tagrisso? Well, Larry. And I said, who's Larry? Well, there he is, sitting right over there. And Larry, with the same EGFR, the whole bit. Anyway.
I just want to go on record as saying I do not recommend sharing pharmaceuticals with other people diagnosed.
Anyway, Larry saved my confidence and hope and all of that.
There's a lot of doctors in this room, by the way.
Oh, are there? Okay. Anyway,
No.
so that was our little story. Do you want to say anything, Joanne?
No, you've said it.
You did a good job,
Thanks, Ron. We're ready to take it to the back.
Thanks, Danielle.
You're welcome. You guys, yeah.
So my name is Keith. I'm one of the younger, newer folks in the crowd, but I was diagnosed back in 2018 and went through all of the emotions that you described, went through the whole progression that you described of, oh, it's a cough, it's a swallow, it's a whatever. So I experienced all of that. It took me a full year before I honestly got up the courage to come to one of the living rooms.
It's been a while.
I wished I had found it sooner.
Yeah.
I honestly do. I'd heard about it, but hadn't been able to overcome that internal barrier to join the crowd. But I'm certainly glad that I did. You know, I was diagnosed and then had to go through a full left pneumonectomy, and then went through the chemo, and then got into a clinical trial though on the back end of that. And so clinical trials have been something that has become very important to me personally. So I'm 6 years out now. I am disease-free. And actually one of the items that the GO2 turned me on to several years ago was, to me it was completely random, but they said, you know, we have this company that is looking for patient representatives, that is working on a project to redesign, reinvent clinical trials. It's Boehringer Ingelheim. I don't know if I can say name on?
can. It's
Okay. Sorry. But we're about to publish the results of that, which hopefully will go into some publications here soon. They're already starting to implement the results of that in their own work, which we're hoping is going to get picked up by other companies as they see the results of what this worldwide panel has done of medical experts and patient representatives. And so I think GO2 absolutely gets credit for being a part of that. And I want to thank you for turning me on to that opportunity, because this is going to sound really weird to say this, but I feel like my experience with lung cancer has blessed me in a way that I would not have otherwise. Opportunities like this would never have come up, would have been involved. There are other things that I've been able to do and done that honestly I thought had passed me by. One of the other ones, it's a little bit out there, but you mentioned the endurance program. I was involved in the endurance program. I created my own, which, and it's extremely unusual for a person with one lung to do a half Iron. I actually did 2 races this last year, and at one I ran into another athlete who had one lung. And
Wow.
it was this amazing moment where the two of us,
Sure.
we hugged. I mean, we had this amazing connection that clearly not many people would want to have, but it was actually a really inspiring, hopeful moment for both of us. Yeah. And we both, hope that when other people see things like that, that they're able to gain hope and inspiration from it as well. So I do still have one more goal out there. I don't know if it's ever, but I do want to become, if it's ever possible, the first one-lunged athlete to participate in the Ironman World Championships.
Wow.
Hasn't happened yet. It's one of my goals.
I love it. I love it.
Do it.
Thank you so much for sharing all that. And I think, yeah, like I said, there are many ways for people to find hope and inspiration, and for people to take back some control in a time when things feel so out of control. Being able to engage in multiple different ways, right? Whether it's coming to meetings like this, half Ironmans, being a phone buddy, participating in research, and others in here have participated. And the participating in research thing is, I think, something that maybe we don't talk about enough, or being part of the solutions, right? With industry partners, BI and the like, who are constantly looking for the patient experience, the real world experience, and the patient voice to come in and help them be better and do better, right? So thank you for bringing that up. Yeah.
Yeah.
Hi. Okay. My name's Amita. I was diagnosed in January
A little louder.
of 2019. I'm ALK positive, and I was diagnosed primarily with neurologic presentation, so I had a lot of brain metastases. And I was diagnosed 6 months after my mother was diagnosed with lung cancer, so I'd been a caregiver for her, and this kind of came out of the blue. So that was kind of a shock. And then initially was not doing very well. It was my daughter who actually found GO2. And then initially, I was like you, it took me a while to want to come, but my husband and daughter would come. So they kind of paved the way for me. And I will reiterate what everyone here has said. I got education, hope, and a community. And it's been very invaluable. And I've told other people about GO2 just to make sure that people know this is there, whether they avail themselves of it or not. And I think, again, trying to help as much as we can, because it's such a worthy cause.
My name is Nitin, and as she said, I'm her husband. And for me, I guess if I were to think of it from a hope perspective, the thing which we worry about most are our children. And we worry about any genetic components within all of this that could get passed down. So one of the hope that we have is the Inherit study that has started. People, it seems like people are now starting to look a lot more as to how lung cancer gets passed on. Could it be passed on? And what our hope is that over time, that allows early detection, and that the screening is something that is just done as screening is done for other diseases. And we mainly worry about our children. GO2 has been wonderful for us. I think it's a support that we've got. Luckily, she's a physician, so we have enough support from the medical community, but I think the support from just all of you and coming in and listening to folks where it's not really a downer, but hope is what makes us come back. And that is what we are very grateful for. So.
I love that. And I think your point about expanding screening risk factors to include, potential genetic predisposition is really important. Obviously, it's important to us. We've talked about the Inherit study here and some of the work we're doing with 23andMe, us and other groups are doing with 23andMe to really take that deeper dive look. But I think it expands even beyond the, genetics or germline, potential for risk here. But it is important that we expand. And a lot of exciting things are happening, even, not just in lung cancer, but in multiple different cancers. Can we detect cancer early with a blood test and be less invasive and, offer less risk, although I have my own opinions about low-dose CT and flying across the country being very similar amounts of radiation, but that nobody wants to talk about. I just, you guys have heard me say it. There's no big sign when I'm walking onto an airplane to fly to New York letting me know that radiation is going to be a thing while I'm up there, let alone that the dose is very similar to LDCT. But that's my opinion and beside the point. There's a lot of really great folks working on expanding not only the risk factors for what's currently available, which is LDCT, but a lot of really smart people working on identifying cancers in different ways. Yeah. Hi, Lovely.
Hello. I'm Pep Pritchard, and in September of 2019, I was in Seattle kayaking on Lake Union. I was up visiting my daughter and her husband and their cat. I'm heavily allergic to cats, but they did everything they could to get all the cat hair out of the house and put the cat in the cat house or cat hotel, and I came home, and with the chronic bronchitis and cat allergy, I was just breathing terribly, and I couldn't breathe and had trouble sleeping. So I went to see my pulmonologist. She took an x-ray and said, "Oh, this is not good." I said, "What did you find?" And she said 2 spots. So that began my journey, and at that time my mouth dropped and I was like a deer in the headlights. And I came home and told my other daughter, and she, like these very together young technologically knowledgeable people, went on the internet and said, "Mom, there's a support group meeting a mile and a half from our house." I said, "You're kidding." She said, "Yeah, we're going." And so we came, and we were surprised what a wonderful dinner, and not just water, but wine and sodas and wonderful people.
Wine grabs everybody. Okay.
So I thought, oh, this is really good. And not only that, I learned a lot, and I did feel like I didn't have a death sentence. and I had already had one sister who died of lung cancer with brain metastases, and would take my turn going up and taking care of her. She lived in Oroville. So I'm now hearing this. I want my daughters and niece and nephews to get their tests too.
Yeah.
And I have hope for them, and I've been through radiation and, radiation and some chemo, but then things perked up from stage 1 to stage 3B with more growths in my lungs. And I can only blame the insurance companies who kept refusing PET scans. And they did it again today. So I am not pleased with them. I do not condone what was done in New York, but I understand the anger.
Yeah.
So, with hope in mind, and a new insurance company in January, I hope to have some other news for you.
Thanks,
Thank
Pat.
you.
My name is Fred, and I was diagnosed with stage 3B lung cancer in 2013. With maybe a week or so of having, had the diagnosis confirmed, I heard an ad on the radio that Stanford University was having some kind of a meeting or seminar in Palo Alto that, was for lung cancer patients. So I went. I phoned up and they put me on the list. I got a lot of interesting information. This was my first time I heard about, the various mutations and genetic testing and everything else, and what combinations of genetic testing work, and so forth. I mean, what combinations of targeted therapy work, and at that time why they didn't work with chemotherapy, although we know that's different now. But anyway, this was quite a few years ago. And sitting next to me was a man named Neil. And he had one of Bonnie's books. And he said, boy, I just got this, and I wish I had this when I was first diagnosed. And that's how I found out about the organization here. So I phoned up, and I got a hold of Danielle, and she said, get down here right away. And we had a meeting in that room over there, and she said, now here's a good oncologist, at Kaiser, and here's the genetic testing you need to do, and here's what et cetera, et cetera. And that was good because genetic testing was not routinely done for a lung cancer diagnosis at that point. Matter of fact, it wasn't even offered by Kaiser. So I went through Foundation Medicine to get my first one, and eventually found out I was KRAS. Well, as I proceeded, I signed up for a session with Second Opinion, which is a group of experts in lung cancer that meets in San Francisco. And they gave me the cheery news that I had a year to live. So I had attacked this full force with chemotherapy and radiation. I went through several of both. I was on targeted therapy for a while because they found a ROS1 mutation that didn't turn out to be correct. And eventually I went on immunotherapy. Well, it was a little over a year when the PET scan showed that my pancreas was in really bad shape because of the medication. My oncologist said, hey, we got to take you off this for a while. This is not good. So I went for 3 months. I was having a PET scan every 3 months. I went 3 months with a PET, without any medication. And PET scan was clean. I went for 6 months. PET scan was clean. Still no medication, 9 months. A little over a year, something showed up, so I went back on immunotherapy. And it's been over 2.5 years, about 2 years or a little bit more, after the second round of immunotherapy, I asked if I could, suspend it for a while and see what happens. And I haven't had any medication since. So I think it was a while back, maybe about a year ago, I told, Bonnie, that's right, 2023, chronically managed, that's it.
Thanks, Fred.
So you have to really take the initiative and not believe all you hear, from the experts.
For sure. That's it.
Okay.
That's for sure. Thanks, Fred. Michelle, is there anything online? No? Thank you all so much for sharing. We've got a ton of dessert. I know people are maybe chomping at the bit, and if you haven't had your big holiday feast that Michelle worked so hard to get into, we want to get to that. But what would the end of this meeting be without a little bit of housekeeping? Our next Gathering Hope Community Social, excuse me, which we talked about, is on January 14th. I cannot believe it's almost 2025. If you haven't attended, I encourage you to try it just once. It's like I used to tell my kids when they were little all the time, you don't get to tell me you don't like something on your dinner plate until you try it at least once. I think the people that do attend find great hope and connection and community in that meeting as well. Tonight was a little example of what that meeting looks like on more of a regular basis. So January 14th. Our next living room is January 21st, right here in this room. We have got a med-onc who's very near and dear to my heart, and been part of our organization since virtually the very beginning, Ravi Salgia, who has, when I first met him, he was at City of Hope in Southern California, and I don't want to mess this up, and I'll let him share the whole story about it, but I believe he's in Chicago now, Michelle? Ravi, or is he still in? He's still in LA. But City of Hope, Cancer Treatment Centers of America, which I think a lot of us are familiar with, are no longer a thing. So City of Hope is taking over these hospitals around the country, and Ravi's really spearheading that. But when I say he is a genius when it comes to not only what's happening right now in lung cancer, but what's coming down the pike, he's a genius in explaining it in ways that people can understand. I just absolutely adore him, and
amazing.
I cannot wait for him to come. He has not done a living room since probably 2011.
Yeah, but
or
he
12.
would do it if we asked him to.
Oh, he's coming in January, so we're really excited to have him
You
here.
must come.
Yeah,
He's
it's going to be great.
He's absolutely amazing.
So with that, thank you all again so very much for sharing your stories. Thank you to those of you watching online. I hope you loved hearing everybody's stories of hope and inspiration as much as I did. I want to give a shout out and a round of applause to my other friend and colleague at this organization, Michelle Zay. I mean, she really, yeah.
And she hates you to do this.
Yeah, she's so incredible. Now she's turning red.
So you do it more.
But I mean, she is, when I say the behind the scenes, she is my right hand when it comes to this programming. She works single-handedly to identify the speakers and the topics and get everybody in here either live or virtually. The Gathering Hope, I mean, I could go on and on and on. Penn TV, all of this stuff. Oh, that was such a loud yawn.
Oh my God,
yes.
yes.
And I really could not do this without her. So a huge thank you to Michelle, to Penn Media, who comes in here tirelessly. Again, they come in early in the day and get all of this stuff set up so that folks at home can also be a part of this programming live and in real time. And when we do have speakers, it allows them access wherever they are in the country or in the world, depending upon what time it is, to ask questions of these experts in the field. So thank you to Penn Media, to our very own James Hall, who will take all of this content afterwards, edit it down to a palatable rewatch for anybody who's interested in that. And really the entire GO2 team. I know I walked through really quickly all of the hard work that has happened just this year, but it's just sort of, a very quick peek into how tirelessly everybody does work and how committed everyone is to affecting change in this disease. So thank you to my whole, all of my colleagues at GO2. And of course, I have to thank our supporters, Amgen, AstraZeneca, Bayer, Boehringer, Ingelheim, Bristol Myers Squibb, Daiichi Sankyo, Eisai, Foundation Medicine, Genentech, Johnson & Johnson, Merck, Mirati, Therapeutics, Novartis, Novocure, Regeneron, Sanofi, Takeda. Thank you all for all of your support, and we will see you guys in 2025. Thanks, everybody. Yeah, Happy New Year, Happy Holidays, all of that.
Happy.
I can't believe.
So I'll be brave if you're brave. I'll be brave, but only if you're